these are the things you need to set up an adult ventilator.
Okay.
So you need your circuit kit.
Okay.
You need a bike connector. This we normally keep in the blue trolley. You need water for irrigation. Depending if your patient needs a trachea or ET tube, this is what you need: your closed suction and your CO2 monitor. So first thing first, you have to connect your oxygen and your air into the right circuits.
Okay.
So the air is the one with the black and the white head. So it has to go to where you see air, the air circuit, which is here. You plug it in. And then oxygen is the one with the white white rope or I don't know. Just plug it in where you see oxygen. Make sure it's properly connected. Remember your white or your black. White is for oxygen, black is for air. And then you have to plug in your ventilator to the power and your humidifier to the power as well. So this you plug in and you plug in, and then you come at the back of the ventilator, which is where you will turn it on. So you turn it on depending on how the switch comes. Some of them come in a silver knob. So just turn it on and you will see your ventilator start booting. While you're doing that, you can start opening your kits, the pack. Remember, it's written adult ventilator dual heated circuit kit. So your ventilator, when it's turned on, will prompt you to start your security or your safety check, sorry. So it will ask you, do you want to start your pre-use check? You say yes. It's a touch screen. So it starts internal testing. It asks you here, connect the test tube between inspiratory outlet and expiratory inlet. So that's where you use your bike connector, and you connect this, your expiratory outlet to your inspiratory outlet. Okay, and then you accept. You say okay. Here it asks you to unplug your power cord. So this, you unplug it but then you have to keep an eye on it because it is a screw. It is, so you unplug it and it asks you to reinsert it. You reinsert it and it carries on with the test. Now it prompts you now to connect your patient circuits, which is this. So you unload it. You have your inspiratory and your expiratory, and then have this one as well. It comes like this. And this as well. So this goes in like this. You hear a click. This, remember, it has this. It goes in like that. Clicks in. This goes from this one, from here, into your inspiratory. Remember, you connected the blue one, which is this one, goes with your filter. Everything is inside the pack. So your filter goes like that, and then so it should be like that. Blue, white with a filter. Make sure it is closed here. Make sure it's closed. It's closed. It will tell you. So you okay, you accept. Unblock your Y piece, which is this. So you unblock it. Okay. Do you wish to compensate for compressible volume? It always ask you that. You say yes. And you've done all the checks. It's complete. So these ones will come into place, like I said, if your patient is requiring ET tube. We also have a different one for tracheostomy. So, but the main focus is to set up a vent. So that's it. You've done all the, you've passed all this, and you will use this for when you want to start humidifying the patient. So you use that to spike this for humidifying that. Yeah, and that's it. Yeah, that one, when you do your proper connection, we don't want to waste this, but when you do your proper connection, this goes to there and then you connect your ET tube. So the yeah, that one, the CO2. And that's it.